describe how important it is for faith community, through the whole suicide prevention, council efforts throughout San Diego County, and what your role is and how badly I just want us to be able to work together, create an environment of trust, which creates a seamless opportunity for us to move together, forward together, and reduce this extremely important public health issue.
We're planning two, what I'm calling community forums, where there will be a dialogue between the faith-based community and behavioral health services to learn from each other, and perhaps for the first time receiving mental health care in our jail system.
What happens in the course of a mental illness is that parents are not educated, right? So my brother, when he started exhibiting symptoms, immediately we went to drug and alcohol abuse. It was very easy to go that route. So he was sent to a drug and alcohol treatment center. And it wasn't because my parents didn't want to do the thing that was the best for him. It was that mental illness is just not something we educate people about. So the more that we can do education in schools, like the mental health first aid, the more things that we can do in schools, these kids are going to turn into parents. And they'll be better off in helping children who 2% of them are dealing with a mental illness between 6 and 12. So right away, there's a disconnect in mental illness to every other disorder. So the way we respond to somebody who has a mental illness versus cancer, and the way the person responds to their provider is different versus cancer and mental illness. So it goes both ways. And all of that goes back to stigma.
Once people have broken that barrier, that protective factor, we all have this instinct for self-preservation. And one thing, even on our darkest days, that prevents us from attempting to take our lives is the actual process. In a very bad analogy, I actually compare this to skydiving. The first time you go skydiving, you're going to be frightened, you're going to be scared, and after you've done it once, you know that the parachute's probably going to open, everything's probably going to, you know what to expect. But that second time skydiving, that second time jumping out of that airplane isn't going to be that as frightening. And so we just need to kind of keep that in the back of our minds as we're dealing with this. Mental illness isn't just sadness. It's anger, it's aggression, it's irritability. So people that we might instinctually push away because they're aggressive are the people that we actually may need to reach out to even more because they don't know how to deal with that pain, and instead they're lashing out.
So was he self-medicating because of a mental illness, or did the drugs and alcohol produce some type of mental condition? So all of this is very important, and it all blends together in a way that, I am committed that people are empowered to be able to ask the questions, to be able to get the mental checkups that are necessary, and that we all work together to find out what works and what doesn't work. Being compassionate. Someone in the grocery store or in the Starbucks, they might be struggling. You say good morning to someone, they said they've had better days, well, you stop in that moment, you can ask them. So being compassionate would be something very powerful to do.
It is an indescribable feeling that must be experienced, otherwise words fail at coming close to an accurate description. I can, however, describe how helpless I felt. After about a month of trying to deal with it on my own with the help of my parents, I decided to reach out to the church I was continuously attending at the time. I was very involved in the youth group and occasionally played with the worship group. I didn't reach out to any of my close friends personally, mainly because I was ashamed and I wasn't sure how they would react to it. I pretended I was okay. I went home and I realized that I wouldn't be able to make them understand. I was so worried about myself and my reputation and how I would come off as a weak Christian. I didn't want to be a bad Christian. I saw that as such a bad thing back then, and it just wasn't an option. So I decided to deal with it on my own, and because of God's grace, I am here and able to speak of this. I thank God for this experience because I gained a lot of wisdom from it, and with it I hope to get others out of it. So it is my hope that you guys can go back to your faith communities or your communities in general and provide a safe place for your youth and your entire congregation to freely express themselves and not feel judged. Thank you.
I was struggling with depression. I had been diagnosed at 13, and it was something that I felt like I was battling on my own. Depression doesn't just disappear. Mental illness is something that we do have to struggle with. And since high school, I was later diagnosed as bipolar, and I've been hospitalized twice. And that's something that I do struggle with. I struggle with it every day. And I do struggle with the questions like Shannon brought up in her presentation. Where is God in this? Why is he making me suffer? Why am I having to go through all this trouble? Why can't it just go away? And I don't know that I have any of those answers yet. But I do know. I know that if I can go to schools, God is putting me in a place where I can reach out to students who might be struggling with depression just like I did, just like I do. And so that's why I'm here. That's why I know that if we can start this conversation, if we can start talking about suicide and depression openly, that young people will know that it's always okay to ask for help, no matter what they're going through.
My mental health struggles actually started when I was about 9, so like 4th or 5th grade. I was starting to get really sad all the time, and I didn't really understand why I was, but I knew I had to hide it and try to overcome it myself because it didn't seem accepted by my family. My friends all knew me as this very cheerful, bubbly girl, and I wanted to hold on to that. I didn't want to lose that image. But by 6th grade, I was really thinking about suicide. I wrote poems about it. I was just thinking about it all the time. And after my first attempt, I got really scared. So I tried telling my mom and my friends about my sadness, and it didn't really go anywhere. I'm from the Midwest originally, and I don't know if that's to blame or not, but so I figured, okay, I have to be happy. Like, I can't keep doing this, I have to be happy. And I didn't know it at the time, but the eating disorder that I developed and battled for the next several years became my coping mechanism. That's how I dealt with the depression, the anxiety, everything that I was dealing with, so that I could keep it masked up. They made it seem so much more serious and that I actually was worth the help that I needed, so it pushed me to get into treatment. And I started an intensive outpatient program the end of my freshman year of college, but it wasn't until I lost my friend to suicide. He had bipolar disorder, and the beginning of my junior year, I lost him to suicide. And his family came to our campus, and I talked to them a lot, and they had so much faith still.
You will notice with smaller kids that they can have diametrically opposing views and hold them as both true, which you don't do as an adult. But when you don't really develop that until you get into your teens, in most cases. So you have somebody who has, now they're being flooded with hormones, they're also coming into a highly emotional time, and at this point they are actually lacking some of the skills for reason simply from development. This is not just a mental disorder time, it can also be physical development, and it makes even that much harder if they do have a mental disorder, which is not just a difficulty that is a spiritual thing. It is a biological thing, which is one thing that we tend to forget.
I think everybody has their own coping strategies. There's no one right way to get over something or to deal with how you're feeling. And it even changes day to day. You know, one day I could really rely on my friends for support, but the next day I might be just as fine being alone and maybe exercising or doing something like that. So it's important to have a bunch of different things in your tool belt so that you can, no matter how you're feeling each day, you can switch around and try different things. A lot of people think that because you want to kill yourself, you're spitting in God's face by saying that, he didn't do enough for you, he didn't give you everything. And so it's meant a lot to me to be in this group and to learn that, yes, I'm suffering, but there's a plan in it. And I think forgiveness and being welcoming has been what's made me get back into my faith. And so I'm thankful for that.
A lot of times when we go through things in our lives and empowering our youth, that's their testimony that gives them that opportunity to make their voices heard, where they can just sit and just embrace and engage and help others to cope with suicide and the things that they go through. So our charge to you today, and I just want you for like 2 minutes or maybe 5 seconds to think about it. Think about if this were your son. Think about if this were your daughter. Think about if this was your mother. Think about if this was your father. So can you do that for me just for 3 seconds? Think about that. Invite NAMI. We have NAMI come into our church twice a year. They do the family to family, which is a group that is for family members who have someone that's struggling with mental illness. And then we also have peer-to-peer come in. And peer-to-peer is where the person actually has a mental illness and they teach them how to deal with that. And again, breaking that stigma.
Somebody mentioned it earlier about teens just need to be loved. They want somebody to understand them. They want somebody to listen to their side of the story. They want help. And again, they really want somebody to just love them, right, Bitsy? And so we want to address some issues with the pastors and youth workers across San Diego County. So we want to help equip you as youth workers or pastors or faith-based organizations, the tools that you need to help to cope with these issues.
We have a show called Faces of Youth. And it's not the different faces that youth are putting on, it's what they're facing every day and what's causing them. We've had kids come in and talk to me on the air. Some have opened up to me on the air that they haven't talked to their parents about things, about eating disorders and dealing with sex addictions and suicide thoughts. And we're wanting to get the message out there. And I'm going to take all the information I can get from you guys today, and I'm going to start letting people know that we have the reach, because that's what we're there for. To put awareness out there and to get the resources out there. My encouragement to you is stop looking at these people as a number, stop looking at these people as a statistic, and start looking at these people as lives, and let's love them through this, because that's the only way that's going to get them through.
It's very important to share your story, to vent to your friends, to anyone that you can find. Vent to them, share your story, and make it known, because, you know, there's a lot of kids out there that are thinking that, you know, it's something unique, it's something that they're the only ones that are going through it. So the more you share your story, it's better.